Hi, I'm Scott Price. I'm a spine surgeon at Pro Ortho, and I work at EvergreenHealth in Kirkland. My personal specialization is in the field of spine care or spine surgery, specifically from the base of the skull all the way down to the tailbone, really. And we deal with traumatic problems or problems that are degenerative in nature. In other words, they developed as a person gets older. Sometimes congenital problems or problems that develop when you're young in your childhood, and everything in between. I enjoy working on cervical or neck issues. I enjoy working on thoracolumbar or lower back issues. But it's really not so much a particular part of the anatomy, but the whole person and understanding what it is that brought them in to see us and figuring out, like a little puzzle, what's going on with their neck or their back. So if you come to me and say, oh, my back hurts or my neck hurts, the first thing I want to find out is how long that's been going on and how severe is that pain.
I have scoliosis, so I had a fused spine when I was 14. The central nervous system was kind of getting pinched towards the bottom.
One of the things that happens when you come to the office is we have you fill out what seems like a large variety of questionnaires and diagrams, but what it's really geared to do is figure out how long and how severely you're affected by this. What makes it better, what makes it worse. There are patients who will come in with just a day or two of symptoms, and there's people who will come in with 30 or 40 years worth of the same complaints, and that's important. The reason that's important is that the vast majority of spinal issues can be taken care of without surgery.
The thing that I liked about him the most was his knowledge and the fact that he could convey that knowledge to me.
So what I really try to do is spend time understanding the patient's problem and understanding their anatomy. And then if it comes to where they need a surgery, try to customize an operation for that individual.
And they do surgeries a lot different now, a lot different.
And so that might be through a little 3/4 inch minimally invasive incision and outpatient surgery for a disc herniation. They go home the same day and feel better that day. On the other hand, it might be that they've got a problem that's been developing for 40 years. And the most efficient way to care for them is getting a team of surgeons involved to correct a major spinal deformity they have. And the most important thing there might not be the size of the incision, but getting the operation done efficiently and effectively and safely to correct a problem that's been bothering them for decades. In terms of surgery, I specialize in orthopedic spine surgery. And I would say that over the past 20 years, I've honed my techniques, and I spent a lot of time in this country and in other countries, both learning and teaching how surgery's done and what are better ways we can do it. And I certainly use all of the minimally invasive techniques that are existing, but at the same time, I bring a perspective where we don't necessarily try to use the most fancy, most advertised, latest technique, because that's not always the most proven technique, and it may not be the most effective.
He took out the old Harrington rod as much as he could, put in new pins, and he put in a spacer. It was a really long surgery. It was like 12 hours.
I've got all the tools that I need to get the job done and to approach a problem from many different directions. That can involve computer navigation, laser guidance, computer guidance, using microscopes to access areas that are otherwise difficult to see. All of these techniques, combined with a very strong, intimate knowledge of the spinal anatomy itself, is how I select a custom operation for that individual patient. And in having the access to all those tools, that's something that EvergreenHealth has very generously provided for our use and for the benefit of our patients.
I really wish I had done it a lot sooner, because I would have been much happier. Just think, if I hadn't waited, I would have just been able to enjoy life a little bit, sooner.
If you come to me as a patient, I will make you feel comfortable as an individual with your spine problem to make sure that you have a successful outcome, which is what we try to do for every person that comes through our door.
Dr. Price is a doctor who really cares about his patients, and he really has a wealth of knowledge behind the information he carries. What he's been able to do for me is great. It kind of gave me back my life. I think he's a great doctor, a really good doctor.